In one of my video, I talk about how USA is suffering from some disease outbreak, including tuberculosis and influenza. Recently, measles have started spreading in some parts of the US and is affecting those who are under 19 years old. Let me give you some of the symptoms of this measles, infection. Okay, it will start by runny nose, continual coughing, and irritated eyes. Okay. Measles can spread quickly among individuals, either close contacts or living within the same compound, or like schools, okay, crowded places. And this measles virus can sustain in the air for hours. Okay, it can survive in the air for hours before dying off. So if somebody close to you and the person cough, you may think, oh, you are far away from the person, but if you are not careful, this measles virus can infect you straightforward. Because of this, some of the schools are in the US have started closing down just because the rate at which the virus can affect the school children is very high. And up to now, the US have not come out with any vaccination, program, to reduce this infection. And most mothers are in the US, they are afraid, okay? Because if one person is infected in the school, all the children will be infected because of the rate at which the disease spread. All the people that are in the school, they will be what? Infected.
About the measles outbreak in West Texas, with confirmed cases now climbing to 124. 101 of those in children and teens. The Texas Department of Health says all but 5 of those cases are in people who are unvaccinated or whose vaccination status is unknown. 18 people have been hospitalized.
And I expect the number of cases and unfortunately hospitalizations will continue to accelerate.
Local health officials say tens of thousands of people in Central Texas may have been exposed to an infected person visiting from Gaines County, the epicenter of the outbreak. Texas's health department says over Valentine's Day weekend, the person, while contagious, visited the Texas State University campus and a restaurant in San Marcos, the University of Texas San Antonio, and a nearby Ripley's Believe It or Not museum, and a Buc-ee's convenience store in a San Antonio suburb. According to the CDC, droplets carrying the measles virus can remain in the air up to 2 hours after an infected person leaves. The highly contagious respiratory virus can cause fever, cough, congestion, skin rash, and white spots inside the mouth. Start of the year, the CDC also reporting isolated measles cases in Alaska, California, Georgia, New Jersey, New York, and Rhode Island, and 9 cases in New Mexico.
Just being in the same room with someone who's sick, if you're not protected, could put you at risk.
The measles vaccine is 97% effective at preventing illness. But in Gaines County, which accounts for more than 60% of the cases in Texas, nearly 18% of people have vaccine exemptions, according to health department data.
So we have a high number of unvaccinated. They just don't believe in it. It's just not something that they choose to do.
Doctors across Texas are urging patients who might be sick to stay out of hospitals for fear of infecting others, pointing them instead to mobile clinics in Gaines County. And in nearby Lubbock County, stop signs like this for those with symptoms, now posted on hospital doors.
If you think you have measles, what we don't want you to do is show up in my waiting room. What I want you to do is call me first, but do not come into our building and don't come into our waiting room. We want to help you, but please don't come in and infect everybody else that may be immunocompromised.
All right, Erica joins us tonight. Erica, you've been speaking to health officials and doctors in Texas. They told you they're seeing more and more people come in to get vaccinated?
That's right. I spoke with the public health director in Lubbock today. She said that her team has given about 100 of the vaccine to prevent measles, that MMR shot, within the past week. Half of those involved parents who had previously chosen not to vaccinate their kids, but seeing this outbreak in their own backyard has actually changed their minds. I also checked in with the Children's Hospital in Lubbock today, where they have treated nearly all of the kids who've been hospitalized. Tom, none of them had been vaccinated. Back to you.
Okay, Erica Edwards for us.